All right. I got a message. It's now streaming live on YouTube.
Okay.
All right. And then when do you want to start your recording?
As soon as I mute YouTube on my computer,
Okay.
and thank you for the reminder. Yeah, there it is. Okay, good. So let me just, okay, we're all set. And now I'm going to record. Okay, wonderful. Good evening, everyone. Welcome and thank you for joining us this evening. We're thrilled to have you with us and thrilled to welcome Dr. Christine Horner, who is a board certified and nationally recognized surgeon, author, expert in natural medicine, and a relentless champion for women's health. She spearheaded legislation in the 1990s that made it mandatory that insurance companies pay for breast reconstruction following mastectomies. Thank you for that. She's the author of Waking the Warrior Goddess, Dr. Christine Horner's program to protect against and fight breast cancer, winner of the Independent Book Publishers Award 2006 for Best Book in Health, Medicine, and Nutrition, and the author of Radiant Health, Ageless Beauty, Dr. Horner's 30-day program to extraordinary health and longevity, which won the ELIT Award in 2017 for Best Book in Health, Medicine, and Nutrition. She has become an expert in thermography, working as an interpreter of thermal imaging since 2017. And in 2022, she opened her own mobile thermal imaging business. And she's going to talk to us about that and about your journey to this, right?
Yes.
From classical medical training through Ayurveda and thermography. It's just really interesting progression and so much promise, and so much what's the word I'm looking for? So holistic, right? This approach, which I really love. So welcome. Thank you
Thank
for
you.
being here.
Yeah, my pleasure. Yeah. So I do have an interesting path. I've had three lifetimes and one lifetime so far. But yeah, so I was a precocious child, and at 10 years old, I decided I wanted to be a surgeon. And I never changed my mind. I was, just like really focused on that. And so, I went through medical school training, and then I board certified in general surgery as well as plastic surgery. And I worked as a plastic surgeon. And I had a really special interest in women with breast cancer because my mom had been diagnosed with breast cancer. So, I was involved with American Cancer Society, the whole thing. So when I started my practice, which was in 1991, I, quickly started watching my breast cancer patients who were walking through the door, becoming younger and younger and younger until finally I was operating on women in their 20s, which it completely flipped me out. Then my mom had been diagnosed with stage one breast cancer, and she'd gotten, the treatment for it. And then she, about 13 years later, ends up getting breast cancer on her opposite side. And so then they caught it super early. She did everything Western medicine told her to do. And so then we thought, oh, she's going to do great. And then 5 years later from that, she ends up getting a metastasis to her bone in her leg, her femur. And she just was like, I don't want any treatment. I'm not doing radiation. I'm not doing chemotherapy. So she died 9 months later. As this like totally rocked my world because here I am, trained in Western medicine as a surgeon and everything and working with the American Cancer Society. And she did everything she was told to do with stage one disease, which is like, do your mammograms because, it hopes to catch it early so that you can, have better survival. But it was like, wow, that didn't work for my mom. And then I'm watching these 20 something year olds walking into my office, which you can't do a mammogram, on them because their breasts are too dense, you can't see anything. But, when that happened, I just thought, something is wrong. Here, like we are doing something terribly wrong, in our culture that is causing women in their 20s, to have breast cancer. So this was 30 years ago, probably. And so I just thought, well, I'm going to go through the medical research and just look to see, is there anything that, the studies show that women can do to help to lower their risk? And I had no idea what I was going to find. I thought pharmaceutical companies sponsored, all the research and everything. But even way back then, I found thousands of studies showing exactly why we have a breast cancer epidemic and prostate cancer and colon cancer and ill health in general. And of course, it comes out it's all diet and lifestyle related. Now, sadly, I had an unbelievable extended medical education, with medical school residencies, 2 residencies. So, anyway, I didn't have a single course in nutrition. I was taught nothing about how to create health, nothing. And it was all about how to, suppress the symptoms of diseases with medications or, just cut things out, right? So at that time, there was this whole convergence. It was like, I really have this amazing life where it's like, okay, I spent my entire life since I was like 10 years old making that decision, becoming a surgeon. And I graduated, and started my practice in 1991 when I was, 33. And almost immediately, it was like the universe conspired to have me do something different. So, what happened, like I said, with my mom, and then my patients, it was like, well, then, discovering that really it's all about, diet and lifestyle. So that took me into the world of natural health. And so at the exact same time that this was happening, insurance companies stopped paying for breast reconstruction. I got a letter from an insurance company saying, we're not paying for breast reconstruction on your 32-year-old patient because it's on an organ with no function. Yeah. I was just like, okay, you've now said that to the wrong person. I was so mad. So I organized a whole national campaign to make it mandatory that insurance companies pay for breast reconstruction by passing, laws. So this was when Clinton was in office. And so at the time, the Clinton healthcare bill had just, plummeted. And so they were like, you can't talk about this in Washington. You have to do it in all the states. So it's like I have to do this 50 times, like worst case scenario. Anyway, we got 35 state laws passed. And then I discovered this loophole law where people are just not covered by healthcare laws. There's an exemption for everything. So then I was like, that's it. I just need to meet President Clinton. So for 2 weeks, every person I met, I said, do you know how I can meet President Clinton? Do you know how I can meet President Clinton? And within 2 weeks, I met someone who knew someone on the Federal Trade Commission and had lunch with them. And 5 days later, I was in Washington talking to President Clinton. And I had to pay $10,000 to talk to him. Everything's bought and paid for. But anyway, it ended up being this 5 year, long campaign. And then there was, divine intervention, at the end where nothing was going through Congress. And so they tacked, it was never even heard in committee, my bill on breast reconstruction, but it got tacked onto the budget bill. And it passed. It reads like a novel. It passed at like midnight. The last day of Congress. So now, there's a federal law that all women, can have breast reconstruction available for them. But for me, the bigger issue was that we even have this, horrible, disease, and that, it's got the numbers, of people that, it's affecting. And so, anyway, when I first met with President Clinton, the television stations, I was living in Cincinnati, Ohio at the time, the television station sent a reporter out to interview me. And it turned out that he had been a teacher of transcendental meditation for like 30 years. So he's like, you really need to learn how to meditate. I'm like, okay, great. So I learned how to meditate, and I was like completely blown away by the, just instant, effects of it. And so then he says to me, well, actually, transcendental meditation is from a system of medicine called Ayurveda, which, like I'm embarrassed to say I'd never heard of, at that time. And he's like, if you want to go, really experience Ayurveda, you need to go to the spa in Fairfield, Iowa, called the Raj, and do panchakarma. So it's their detoxification, program. And I was like, okay, fine. So I go to Fairfield, Iowa. I had no idea what I was getting myself into. So I only signed up for 3 days. Usually you want to do it at least a week. But anyway, so I start those treatments, and they're just like luxurious spa treatments, like, massages and hot oil treatments and steam treatments and all sorts of things. But um, when I looked in the mirror after being there for just 48 hours, I looked 10 years younger and never felt better in my life. And I thought, oh my God, these people know something. So I went crazy learning everything I could about Ayurveda. I got, certified in it. And then I thought, like people need to know this, information. I was completely hostile at the commercials on TV and stuff too, about just the lies that we tell people about, there's nothing you can do about whatever the conditions that they have. And in Ayurveda, virtually everything is reversible, because it all starts, as imbalances. And so I thought, God, there's so many really simple things in Ayurveda that have the most incredibly profound effect, on the body. And it's like people need to know this. So I pitched the television station in Cincinnati to have me be the on-air doctor in the newscast, not talking about pharmaceuticals, but talking about, complementary and alternative medicine techniques. So they went for it. And so that started in 1999. And so that was the first syndicated segment in a newscast on complementary and alternative medicine in the country. And so when I was doing television, I mean, I was just unbelievably like taken over by the power of the medium. Like I would talk about a particular herb, like holy basil is an Ayurvedic herb that has these phenomenal effects as far as it's an adaptogen, and it helps to interrupt all the different steps in the neurochemical cascade of stress. Plus, it decreases all the downstream effects of it. Plus, it has like an anti-depressive, anti-anxiety kind of effect to it that takes effect like immediately. It's not like normal antidepressants that take, a month to take effect. So I do the segment, and it's, Cincinnati, and it's like it's airing at like noon on Thursday and 7:30 on Saturday morning. These are not prime times, right? Like, who's watching this? The entire national supply of holy basil sold out after doing those segments, because there was one company, producing it. So the guy who owned the company, there was a new chapter. So Tom Newmark flew into Cincinnati. He's like, what is happening in Cincinnati? So I had this thing where it's like, okay, here I am now working 14 hours a day, 7 days a week to try to pull off doing my practice while, doing television. And so I just woke up 3 years into it. I woke up and I went, like, I just think I'm going to start crying. My life, I have friends, it was awful. And so then I was just like, I have to quit my plastic surgery practice as what I have to do. I mean, who does that? I was 12 years into it, and I was like, I've got to leave this. And I felt like what I could do for the world, and for people was so much more, by doing the television and then, writing books and media, basically teaching people how to become and stay healthy naturally and avoid the knife, instead of being on the cleanup crew, which it was what I was when I was doing all the, breast reconstruction. So I took the leap, and I left my practice. And so for the next 20 years, I did all, media stuff. I did television all over the country and wrote, several books, and wrote, magazine columns and national magazines, and had my own radio show and everything. So, and that hit. So, nobody was interviewing anybody on television stations anymore. And And so, in the mix of all that, when I was doing all the media work, I got introduced to thermal imaging. And at the time, it was like mostly I was had the interest because I had such a strong interest in breast cancer prevention, that it was mostly about, doing the imaging of the breast. And so I was super excited about this technology because it's truly preventative. It picks up imbalances years before somebody would develop, breast cancer, where you can interrupt that whole, progression. And so I didn't do anything with it. I just felt like, okay, this is like a super cool technology that I, was very interested in. And then about maybe 8 years ago, I thought, well, I want to, explore becoming a physician interpreter for thermal imaging. So, in other words, you get trained to do the interpretation, of the images. So, I researched all the different companies, and there was one company that just stood out, by far, the best. And so, I started working for them. And as I was learning, about doing the interpretations and then having the experience of it, I learned how valuable thermal imaging is for so many other things. So not just the breast, but we can image the whole body, and it gives us just incredible, information again, and really has this phenomenal kind of preventative, power with it, which is why I'm so passionate about it. So when, COVID came and all my media stuff went away like that, it was like another reinvention, right? So then I thought, well, it really makes sense for me to do thermal imaging myself because I'm in such a unique position. Most of the time, when people are thermographers, they're technicians that are taking the pictures, and a lot of them have absolutely no medical background at all. So for me, it's like, well, I can take the images and then I do the interpretation of the images myself. And then I always set up a Zoom call with people afterwards and give them up to an hour, with me to, go over their images, and then, provide coaching, health coaching for them, which is very holistically, based, because that's how I am. And so, for me, it's like, okay, this is a really kind of unique, thing that I can do and provide, which I don't think there's anybody in the country like me that can do all those different, jobs within, doing the thermal imaging. So anyway, I've become like extraordinarily passionate about, thermal imaging, and that's, what I'm going to be talking about, tonight, and share with you why I'm so passionate about it and why it's a technology that truly can help you kind of keep tabs on your health. That's totally non-invasive, completely safe, and really gives you kind of the assurance as far as being able to catch imbalances at these earliest stages and be able to really keep your health. So anyway, you want me to go ahead and do yeah, okay. So I'm going to go ahead and do the screen share here. And okay, so the thing that I find with thermal imaging and is that most people are completely confused. Even if they've had a lot of, thermal imaging done, they're kind of confused about exactly, what it's showing. And I think it stems from the fact that thermal imaging is a completely unique test, and it gives us completely unique information that no other test does. So it's considered a physiological test, whereas all the other imaging tests that we have are anatomical tests. So I'm going to spend a couple minutes just kind of going through kind of the distinguishing, the two of them, so that you'll understand that really clearly. So with thermal imaging, we use an infrared camera. And at the most simplistic level of understanding with an infrared camera, all it's doing is it's measuring the surface temperature of the skin. Like that's it. It's just measuring the surface temperature of the skin. Okay, let's see if we can get this to move. There we go. So then the software program, which will assign a color to every temperature. So if you look at the spectrum on the right side of the screen, you can see the coldest temperatures are going to be this deep violet and black. The hottest temperatures are going to be red and white here. So every temperature is assigned this different color. And then that is what is created on the screen, how the image is created. So in essence, what we're looking at is a geographical temperature map of, any area of the body. Now you can go, okay, well, what's the big deal with that? Well, it turns out that thermal imaging, the reason why it's such a valuable medical tool, all comes from one particular phenomenon, and that is that our sympathetic nervous system will innervate the skin. And so whenever there's any kind of underlying imbalances, dysfunctions, infections, injuries, anything like that going on, through the sympathetic nervous system is going to change the overlying skin temperature. So when we look at this image, another very important concept is that the human body is extremely symmetrical. So when I'm doing an interpretation, I'm looking to say, okay, does that side match that side? Does this side match that side? And then we can come down here and all of a sudden we can see, well, now there's a heat pattern here on the left side of the mouth that we don't have on the right. So it really pops out, to let me know that there's some inflammation occurring in that area, most likely, teeth or gums, we would say. So that's the whole, phenomenon with it, where there's, something going on, and usually we oftentimes, pick things up where people have absolutely no symptoms. They have no idea about it, and no Western medical test is going to pick it up, but we can catch these things at, these very early stages. So the camera is pretty small here. And so you have to be disrobed because, again, the camera is measuring the surface temperature of the skin. And then we'll see the image that shows up, on the computer screen. So we're basically we're taking pictures at different angles, from profile shots and angle shots and so forth. Now, this is a really great example of thermal imaging as a physiological test. So this guy is a thermographer in Europe, and he took an image of himself, and then he drank a massive amount of alcohol, and then he took a picture of himself the next day. So these patterns, we call them mottling patterns, mottling. And mottling patterns represent inflammation in the body. So whenever we see these, we know that somebody's got, systemic inflammation going on. And my job is really to figure out, okay, where's this coming from? So obviously toxicities like drinking alcohol, smoking cigarettes, chemotherapy will cause them. But we'll also see them in people who have problems with allergies. If somebody's got digestive issues, then sometimes we'll see these mottling patterns right over the abdomen and no other place on the body. We'll also see these in people with autoimmune diseases. And then finally, having a lot of stress in your life and emotional upset puts your body kind of into an acid, state and creates inflammation. And so those will show up for that too. So I kind of question people to figure out, okay, what's going on, so we know what type of a program we need to put them on to reverse that, because inflammation is not good for the human body. It's something that drives all the different chronic diseases, from dementia to heart disease to diabetes to breast cancer. Now, all the other tests that we have are anatomical tests. So you can tell immediately these look very different, than the thermal imaging. Now, if I go back here for a minute, you see here again. So in 24 hours, like I said, this is showing up as purely physiologic. There is no structural change that happens to the body in 24 hours. Now, these other tests that we have to image the body are all anatomic. And like I said, you can immediately see that it looks very different than what thermal imaging does. And the left upper square is an ultrasound, the head is an MRI scan, the abdomen is a CAT scan, and the lower image is a mammogram. So what these tests do is they take a cross-section of the human body and they're looking at the underlying architecture. So the only thing that they can pick up is if you have had a structural change to your body. So in other words, they're only going to tell you about something that you already have. But with thermal imaging, we can pick up these imbalances years before somebody has a structural change. So as I had mentioned, I am trained in Ayurveda. And Ayurveda is this 5,000-year-old system of medicine. Traditional Chinese medicine is, thousands and thousands of years old too. And both of them are really focused on how to create health and how to prevent disease, which again, sadly and tragically, I did not learn in medical school. One of the techniques that they use is something called pulse diagnosis. And this is actually based in quantum physics. So we know in quantum physics that at the finest level of life, there's these little vibrating strings, the superstring theory. And so those vibrations are things that give vibrations to all living tissues. So as the blood flows through the body, it comes in contact with every cell, every organ, and it picks up that vibration from it. And that's what we can feel in the pulse. So when those structures are healthy, there's a very distinct feeling to it that you can feel. When they're unhealthy, it's a very different, kind of feel to it. But that's what we're picking up. Now, both of those systems of medicine recognize 6 stages of disease. So it all starts with an imbalance, which gets worse and worse and worse and worse until it's a stage 5 is where there's a structural change to the body. And this is where a Western medical test can pick up that something's wrong. This is very late in the game. So the whole idea with this is that we want to try to pick up these imbalances at these very early stages where they're easily reversible with simple diet, lifestyle, and nutritional supplements. So I always liken thermal imaging to pulse diagnosis. With pulse diagnosis, we're feeling the imbalances. With thermal imaging, we're seeing the imbalances. Now, not everything is going to cause a thermal pattern. And if you think about it logically, if we're measuring the surface temperature of the skin, anything that's close to the skin, so we're talking huge areas of the body, so head, neck, extremities, breast, all of these areas we can see, quote, see with thermal imaging patterns extremely well if there's something going on. The further away you get from the skin, the less likely we're going to see a thermal pattern if there's something that's, dysfunctional. So this specifically is talking about being deep in the chest cavity or deep in the abdominal cavity. And the deepest structures in the abdominal cavity are the uterus, the ovaries, the prostate, the kidneys. So usually we're not going to see thermal patterns for those things. But there's many, many things that we can see, which makes thermal imaging such a valuable tool. Now, when I do an interpretation, I know what the normal thermal pattern should look like for each area of the body. And then I'm comparing each person's images to that. So for example, for the head and neck area, this is what the normal pattern should look like. The nose is so cold, it looks black, and that's normal. And then we get symmetrically cool cheeks, and then the inner eye area is symmetrically warm. Now, when we look at this person, we can see, wow, they've got all sorts of, this is reddish, that's there, so we know it's heat patterns. So this is inflammation of the sinuses. So when we get vertical patterns in the forehead, that's with the frontal sinuses, the maxillary sinuses, which are encased in bone in our cheeks, which does not transmit heat very well, but where it will show up is under the eyes. So whenever we see heat patterns under the eyes here, we know that the maxillary sinuses are inflamed. And those are the ones most involved when you have allergy issues, sinus infections, and active cold like that. Thermal imaging is phenomenal for dental issues. And a very common thing that we see is if somebody had a root canal, for instance, the dentist will look in your mouth, not see anything going on. They take an x-ray, they don't see anything going on, but you have thermal imaging done, and we'll see this super hot spot that shows us that there's a tooth infected there. And then I send that person, to their dentist, and it's like, there's something going on there. And of course, when they check, invariably, they'll find that they've got, an infection under that root canal. And there was no other way, that they could, even see that. On the side view, the external ear is super cold. Anything that kind of sticks up from the normal plane of the body is going to be cold. Anytime we have a contour depression, it's going to be hot. So a great example is the external ear sticks up, so it's cold. The ear canal is a contour depression that's super hot. Now we have to kind of put all the hair, up and so forth, because that's going to cause an artifact where we can't see things behind it. And the reason we put this headband on and these bobby pins here is so we can expose this area right here, which is the TMJ. So that shows us if there's inflammation in the TMJ. There's another area that commonly gets inflamed behind the earlobe. This is called the mastoid process, and that's where all these muscles insert that are involved in chewing. So some symptoms that can occur with these is that a person very commonly could have headaches and neck pain. With the mastoid area, because it's really close to the ear canal, sometimes they'll have weird, symptoms with their hearing, like ringing in their ears or even vertigo. So can be a thing where people will have these symptoms and the doctors are completely confounded about why is this person having it, but then thermal imaging is showing us very specifically why that can be going on. And this is usually related to dental issues. So we can do some approaches that way to decrease that inflammation and improve the symptoms. Now, the nose, as I had mentioned, is so cold it looks black. But there's various different conditions where the nose is going to be abnormally warm. So if somebody has a lot of sinus congestion or infection or an active cold going on, that can cause the nose to be too warm. But when we see the nose being too warm, when there's not a lot of sinus congestion going on, it can be a sign of high blood pressure. And also, if both ears are abnormally warm, that's another sign of high blood pressure. When I do an interpretation, it's a lot more complex than you might think. We always include images in the report, and the images are done in this particular color scheme here. That's called a palette. And we choose this palette because it's the one that makes the most intuitive sense, where red is hot and blue is cold. When I do the interpretation, I'm actually using a total of 6 different palettes. And so these other palettes are allowing me to see things that I can't really see that well in the palette that we have in your report. So some of them are enhancing the heat patterns. This one that looks black and white, we call it a grayscale, and it really pops the blood vessel patterns and the modeling patterns and shows me contour. The one that's in the lower center area is one that accentuates both heat and cold. So if we look at the one that we would include into your report, you can see where this cheek looks like a flat green. When we come down here, we see this cold strip that goes across here. So you can't see that in this one. So this is like when you get your report and you're reading it and then you're looking at your images. I always laugh about this, but I'm like, you're probably thinking, I have no idea what in the world this woman's talking about. I can't see it. The reason is because I'm seeing it with a different palette than the one that's in your report. Now, again, just kind of emphasizing again that thermal imaging is a physiological test and not an anatomical test. So a really great example of that is the thyroid. So if somebody has an underactive thyroid, oftentimes we're going to see this big blue cold patch over it. If they have an overactive thyroid, then we oftentimes see a heat, pattern. So it's telling us how things are functioning, the physiology of it, not the anatomy of it. This is kind of a really cool thing, I think, is that there's a couple different points that we have that will tell us about the health of the immune system. So in traditional Chinese medicine, there's an acupuncture point. This is the back of the neck and the back here. There's an acupuncture point over the second thoracic vertebra that has to do with the immune system. And so in traditional Chinese medicine, they said if that area is cool, then, the immune system is depressed. And then thermal imaging, amazingly, if the immune system is depressed, we get this kind of cold circle right over where that acupuncture point is. There's a corresponding point right in the center of the chest here. This one's a little bit more unusual. This one I see pretty frequently, but when I see both of those in somebody, I know that their immune system is really struggling and that we really need to focus on strengthening their immune system. Now, breast thermal imaging is the area that has the most confusion in thermography, and rightfully so, because I find that even people in the industry talk about thermal imaging as if it were an anatomical test. And by now it's not, it's physiologic. So mammograms, ultrasounds, MRI scans, these are tests that are looking for breast cancer. With thermal imaging, ideally, we are not looking for breast cancer. We're looking for physiological changes that can occur in the breast, again, sometimes years before somebody develops a breast cancer. And we can completely interrupt that process and actually reverse it very quickly by doing diet and lifestyle improvements and then adding certain key nutritional supplements. So there's been 800 studies that have been published in the medical research on the topic of thermal imaging and breast cancer. So it has been extremely well, studied. And what we found is that if a woman, has significant findings, and those findings are things that are have been determined, over time. So there's like guidelines that I have to follow as far as what constitutes a significant finding. A lot of it has to do with symmetry. So again, the human body is symmetrical. So if we have patterns on one side that we don't have on the other side, then that would be possibly a pattern of concern. We also have to look at the absolute amount of heat in that pattern. So you can have all sorts of patterns over the breast, but if they're very light, they don't really mean anything. When we have, a significant amount of heat in it, and I'm doing kind of absolute temperature measurements of these, if it falls into a category, that's significant. Also, the configuration of, certain patterns will play a role too. So when we see somebody who's got a lot of activity going on here, then what I do is we really focus on really interrupting this process. Now, the breasts are unbelievably sensitive to diet and lifestyle and emotions and nutritional supplements, and they will change rapidly. No area in the body will change as fast as the breasts do. So what we do when we see somebody like this is we do what I call the full court press in diet and lifestyle, as far as I have a book that I wrote on all the natural techniques towards reducing your risk of breast cancer, and I usually refer people to that so they can read through it, and then they can determine, okay, there's going to be one or two things that they find where they're going to go, I had no idea, and I'm the worst offender. And it's like, okay, that's what you need to focus on changing. And then we add certain key nutritional supplements, and then we'll re-image someone just 3 months after we make those changes. So in this example here, the person on the left is the same person on the right, just 3 months after she improved her diet and lifestyle and started the nutritional supplements. So we get these astounding, improvements and reversals. And it's like when somebody looks like this, we have stopped it, from progressing into breast cancer. But this is the only way we can detect those imbalances. No other test is going to show, any of this. So this is a truly, preventative tool. Here's another example where, again, symmetry is so important. So you can see that the left breast is a lot warmer than the right, the left nipple is a lot warmer. And then we have what's called a closed circular pattern here, which is a type of a pattern that carries some more risk, associated with it. So these things are telling us that there's an increased future risk of developing breast cancer. So, again, we can interrupt that whole process. We did the same thing with this woman, full court press, diet and lifestyle, nutritional supplements, and 3 months later, this is how she looked. Now, another very important thing is that we know that no test is perfect. And we learned this kind of the hard way with mammography, where we thought, oh, it's the only test that you need to have done. And then when they did the long-term studies on it, it was like, oops, it's not as good as we thought. It misses a lot of, tumors, because women have dense breasts. You can't see anything through it. You can't use it on young people. It overdiagnoses and leads to unnecessary biopsies. So what we learned is that no test is perfect, and no test should be used as a standalone test. So with thermal imaging, again, this is a physiological test. And so what the research shows is that if we combine it with an anatomical test, then we get a much better kind of complete evaluation of the breast tissue. So I always recommend that people use ultrasounds because they're completely harmless to the human body. They give us a beautiful view of the underlying architecture of the breast. But just as a normal kind of schedule, we say, okay, once a year we do thermal imaging and we do ultrasounds to monitor. Now, sometimes we do thermal imaging more often than that with breast thermal imaging because things change so fast, and because we want to monitor when we get into situations like this to make sure that they have improved. I'm going to skip through the research there. Now, the abdomen, the belly button is normally hot because it's a contour depression. And then usually we see coolness around the belly button just because there's a little bit of extra fatty tissue on most people in that area. When we start to get digestive issues, showing up, there's certain characteristic patterns that we'll see. And one of them is that we'll see these vertical lines on either side of the abdomen. We think that these are dilated lymphatics, and that's usually associated with a leaky gut. And again, lots of times I'll see these things, and a person has absolutely no awareness that they've got any digestive issues going on. In Ayurveda and traditional Chinese medicine, it's really well understood that as a pillar of health, the diet and digestion is one of the most important things. And when that's off, it can lead to all sorts of diseases. And particularly if you have like leaky gut, for instance, that has been really shown to be associated with a variety of autoimmune diseases that can come from that problem. So again, they have no idea. And so this is a way that we can pick this up and get it at an earlier stage where we can easily correct it. This is another pattern, the modeling patterns, like I showed you with the guy that drank the alcohol. And sometimes we'll just see it over the abdomen as we do, in this woman here. But when we see this kind of, modeling patterns here, this is another sign that there's, serious digestive issues going on and leaky gut, so that we can, address that and prevent future diseases from occurring. This is just talking about the different causes of the modeling. We kind of talked about that before. And so, again, whenever I see those modeling patterns, I'm trying to figure out, okay, where does it fall into here? So we know how to reverse that inflammation in the body. Chiropractors who have a clue about thermal imaging really like to use it because they're a little limited, like dentists are, where their main kind of tool that they use is X-ray. So that's going to show them the position of the bone. But thermal imaging is going to show them kind of the condition of the soft tissue. So we can see kind of where the focus of the inflammation is. And then also because of the configuration of the patterns that we see here, that's going to tell the chiropractor about what specifically is going on with it. So it really helps them, to better treat their patients by having a more clear understanding of what's going on with them. Now, the bottoms of the feet, the normal patterns that we see are right here. So the feet are so cold, the toes are so cold, you can hardly see them. And then they're symmetrically warm instep. When we have one of the insteps being a lot warmer than the other one, this can be a sign of plantar fasciitis. Again, I see this so commonly in people that have absolutely no symptoms. And so this allows us to get in there with some preventative care, the stretching, the inserts that we put in the shoes and everything to prevent them from developing plantar fasciitis. Because once you got full-blown symptoms, it really hurts and it takes a long time to get it to quiet down. Another amazing thing that we can do with thermal imaging is that people who are diabetics, kind of the worst and dreaded complication that can occur is to get a diabetic foot ulcer that could lead to amputation. So with thermal imaging, we can actually see areas where a diabetic foot ulcer is kind of forming under the surface. You can't see anything on the skin. And then that allows us to do our kind of interventions there to hopefully prevent that from ever happening so that they don't run the risk of an amputation. Now with the hands, the normal patterns are here, this lower square on the left. So usually we have heat patterns at the base of the thumb that has more to do with just the fact that we're using our thumbs all the time. So there's increased blood flow there with movement, and then the fingers get colder and colder out to the tips. When we have heat on one side and not the other, that can be an indication of arthritis. Then there's various different conditions where the hands become abnormally warm. And so when they're completely warm like this, we call that a glove pattern, and it's almost always associated with elevated blood glucose. So this is a way we can pick up pre-diabetics and diabetics. When the fingernails are red hot or white hot, this is another sign of high blood pressure. And then this is one of my favorite patterns here. So normally we expect to have symmetrically warm patterns, not too warm in the palms of the hands. When we have heat on one side and not the other, it could be an indication of carpal tunnel syndrome. And then in people who are energy workers, and this person was a Reiki master, they produce so much heat from their hands that they get these kind of perfect circles, hot circles in the center of their hands. And then finally, looking at the lower extremities, we're looking for varicose veins. We can also see if, one knee is warmer than the other knee, and looking at the, ankles and toes and all sorts of stuff. But anyway, so that is, to me, an amazing preventative tool that shows us all sorts of really interesting things. And again, it's completely safe. There's no radiation, there's no pain involved. It's FDA approved. And it's like this amazing tool that allows us to monitor your health. And I always recommend that people get imaging done, once a year, maybe a half body or full bodies, because it gives us so much more information, about their health. But it just allows us to monitor health and be able to interrupt, the progression of disease because we're picking it up at such early stages. And just kind of tying it back, into Ayurveda, it's like, the whole point of Ayurveda is enlightenment. I thought it was the coolest thing when I was studying Ayurveda. And it's like, yeah, we're doing meditation and all sorts of different techniques to kind of enhance higher states of consciousness, and ultimately the goal is enlightenment. And I'm like, how different is that from Western medicine? And so, their focus too, they're using pulse diagnosis, to be able to pick up imbalances at early stages so we can finely tune people and keep people as balanced, as we possibly can, because perfect balance is perfect health, is, allows these higher states of consciousness. And so not very many people are trained in pulse diagnosis. I mean, it's a very complex, technique to learn, and it takes years and years of, practice and experience. So it's not like it's something that's readily available for people. But for me, thermal imaging is readily available. And it is a, technique that really allows us to see these imbalances at an early stage, and then, get things, quickly corrected so that we can keep your, physiology as healthy as possible. So that's why I love it, so much. And I feel like it's such an incredible tool, that people can use. So I'm going to be in Mountain View doing imaging on April 12th and 13th, and possibly the 14th, which is a Sunday, if there's enough people that are interested. So I think we'll have information for my website. Do you want me to go ahead and give it out?
Sure, go ahead.
Yeah. Okay. So my website is MED, Therm, THERM, and then S is in Sam and C is in cat.com. So medthermsc.com. And on my website, you'll find just, lots and lots of great information. There really is a huge difference in various different thermography companies, and the resolution of the cameras are like drastically different. And this is, one of the reasons that I really researched it like crazy and went with a company that had the highest quality cameras, the highest resolution, the best, reports, and the person who interprets it is extremely important too, to make sure that you get the best, information. And so everything for me, with that company is really set up to give you the best, you know, images and the best kind of reporting system. And then like I said, I've included personally doing coaching, calls with people afterwards so that you can get the best value, out of getting your imaging done. So on my website, there's like a purple box at the right upper hand corner that says book an appointment now. And so all you do is click on that. Then you click on, what type of imaging that you want, the half body, the full body, and then it'll say location. And so I have the location for Palo Alto, Mountain View there, and you would click on that. And then you just follow the prompts with it. You can, choose the day and the time that works best for you.
Fantastic. Thank you so much. I know there are a couple people who are listening who have had their images done. I've had mine done, so it's a really wonderful experience. My question right now, and if you have any questions, go ahead and raise your hand or type it in the chat, and we will answer those for you. But I was thinking about Ayurveda as and Chinese medicine as um, just ancient practices, and I love the combination of thermography, which is so new. Um, and what it can tell you about, this kind of, I don't want to say real time, but this look to see what's happening, right? And
Mhm,
have there been any studies, like, because you went for like a panchakarma experience,
mhm,
right?
mhm.
Wouldn't it be fun to do like a thermography before panchakarma?
Yes. Yeah, yeah, yeah. Believe me, I have like pitched it for all sorts of people with devices. Like, let's do a before and after so we can see what's happening, with that particular device, because you definitely would see, the decrease in inflammation and, and all sorts of things. So yeah, I mean, it would be anybody out there that's got, these, different kinds of devices that help with detoxification and things like that. I mean, I think doing thermal imaging as a before and after, it can be very valuable for that. They did do, one for the grounding devices, so like there's a book, that talked about the earthing. I don't know if
Yes.
you remember the book. Okay. So it's the grounding, devices that are used so that it's really kind of discharging electrons into the earth and decreasing inflammation. And so they use thermal imaging on some of their studies, for that book with the before and afters to show the huge difference in the amount of inflammation in the body with those devices.
I
Yeah.
think there's a lot, and the TM people, the transcendental meditation people, have done all kinds
Yes.
of research, right? Um,
Yeah.
have they done use thermography to? I know there's so many papers on TM.
Uh-huh.
Um, have they gone? How old is this technology, by the way?
Well, believe it or not, so when you're saying that, this is relatively new, and it's like, well, you know what? They go back to Hippocrates, BC, right?
Thermography?
They would put mud on the human body, and they'd see where it would dry the fastest. And that's where the area of disease was, because that's where the heat patterns or the heat, area was. So the concept of it isn't new. The concept of it is
Like
actually
heat
centuries,
generated in.
old. But
Wow.
it wasn't until, kind of the early, turn of the century where, we started, uh, creating the infrared cameras. And then, from there, I mean, to begin with, it was a real basic tool, and there was no computerization. So things had to be like handwritten out and everything. And so that made it really difficult. And then when it became computerized, like in the 70s and 80s, is when it really took off, and it allowed us to then become unbelievably sophisticated and being able to see these just teeny tiny differences in temperatures that we could easily pick up. So it's a very sophisticated tool now that again just gives us like phenomenal information about health.
I
So
just have a
somebody,
feeling. Yeah, so that I have a feeling there's going to be a lot of
okay, okay.
so I have three questions so far. Can the half body be done either upper or lower?
So a half body is the upper body. So it's the head, neck, the arm, the head, neck, chest, upper back, abdomen, lower back, and breasts is a half body. A full body is something that is all of that, and then it includes the extremities. So the arms, the legs, the hands, the feet. Yeah.
Okay. And Lucy wants to know how hot flashes show up. That's a very interesting question.
Well, that would be like in the moment of it. I mean, I haven't captured somebody who's having a hot flash in the middle of
Yeah,
it,
it
but
kind of has to be acute. Yeah.
so I haven't had that personally with me imaging, but I've had other thermographers that, reported, when I'm doing the interpretation, they were having a hot flash. And mostly you see sweating, looks like it's cold. So you get blue streaks of the sweat, coming down, but I haven't really noticed having like any kind of like modeling patterns or, serious heat flush. Yeah.
Yeah, because they're such acute
Yeah.
uh occurrences. Yeah.
Yeah.
Um, just real quick, Susie wants to know how often you come to Northern California.
Well, so the first time I came was in January. So I met, Christine Roche. I spoke at a lovely retreat in Half Moon Bay, and met Christine Roche, who's a nutritionist in Palo Alto, Mountain View area. And so she was like, I want you to come do thermal imaging because there's a real need, for it. And obviously, with my qualities are different, kind of unique compared to a normal thermographer. And again, just having the highest resolution, equipment and everything. So she, really facilitated help setting it up. So for me to come in January. And so when I came, I was fully booked, like 3 days of, just completely booked. So normally what happens is that when we do the interpretation of the images, the follow-up is based on what your for women only, basically, your breast findings are. Because the rest of the body doesn't change that fast. Like I said, usually we do, thermal imaging once a year. The very soonest you could do it is at 6 months if you're doing, other areas of the body, but the breast will change quickly. And so what we want to try to establish in the first year is a stable baseline. So if we see patterns, and every woman has, patterns as kind of unique patterns, as kind of like a fingerprint. And we don't know, with that first thermal imaging, if those patterns are something that are truly significant or not. Are they changing? Are they not changing? So in the first year, we have to do some follow-up imaging of the breasts only so that we can do that determination. And so the follow-up is, 3 months to 6 months. So what I've scheduled is to come every 3 months, because that just kind of makes the most sense. So I'm going to, I was here in January. I'm going to be back in April, and then I'll be back in July, and then I'll be back in October. So it's every 3 months like that.
Excellent. Thank you.
Mhm.
Durga wants to know, could you talk a little bit about this? Once you get a thermography done, the
Mhm.
process of rebalancing and what it was like to work with you to,
Sure. Yeah.
what are the
So
services?
Yeah, so what I do, for everybody is I've just included an hour Zoom call with me consultation. Normally I charge $300 an hour to do a consultation. I charge you nothing additional for the, that's just part of the, fee for doing thermal imaging. And so what I do is to go over, the various different findings that we have, and then I'll give, recommendations. And like I said, if there's any possibility of doing, something holistic, as far as an approach with that, that's what we do. So kind of throughout my lifetime, I've had this fascination with all the different kind of modalities out there. And there's so many, different things. And so I'm the yes person. I want to see that. I want to experience that, So man, I know a gazillion people all over the country, and all these different kind of like amazing, techniques that are done. So for instance, if we see somebody has sinus, inflammation, and again, lots of times people have no symptoms with it. And so then the most common thing is that they've got an allergy, reaction to something environmental, most likely. And so that, is something that really causes a lot of havoc, in your body. And so sometimes people have allergy symptoms that they don't even realize they have them, because they seem, fairly subtle and everything. But I discovered this technique that is called NAET, Nabudrapad's allergy elimination technique, which is based in kinesiology and acupuncture points. But they can determine exactly what you're allergic to. And then through doing tapping, on the acupuncture points with some kinesiology stuff going on, it instantly takes your allergy away. So, so I interviewed Dr. Nabudrapad on my radio show, and when I was talking with her, I thought, well, I don't have an awareness that I have any allergies. Like I've never had hay fever. I don't have that kind of stuff. But then as I was talking to her, she was like, no, it's more like a sensitive, you can think of it as sensitivities. And so then I thought, well, I guess I got some digestive stuff or occasional laughs, stuffy, whatever. So then I thought I'm going to try it, check it out. So I go to the website, the NAET website, and it's like you click on find a practitioner, you put your zip code in, and then they have all these sub certifications. So I chose the person that had the most certifications. I was living in New Mexico at the time. So I went to her and I did this whole series of treatments. And I'm telling you, it changed my life. It was unbelievable. Any food, I mean, even if you had anaphylactic shock to bee stings, it can take it away. And like food things, like I couldn't, bread would make my fingers swell. Well, I can eat bread now. I don't have any problems at all. And so it totally eliminates these like instantaneously. I'm like, how cool is that? So those are my favorite, kinds of techniques that I find for almost, anything. And I'm very big into like subtle energy devices, too. And I've just seen incredible, healings with that. So I generally try to talk with people about, okay, maybe you have to go see your dentist. Maybe you need to go see, a regular doctor, but I also just know tons of different tools that can be used for various different things that, and mostly I love these things that work so quickly and can instantly kind of reverse conditions that you don't even think are reversible, but they are. Yeah.
That's exciting. Susie wants to know when you're on the half body visualization, are you seeing enough of the lower organs to understand what's going on?
Okay, so again, we have to think about thermal imaging as a physiological test. It's not an anatomical test. So it's going to show us, like I said, when I showed you the images, we can see things really clearly, for that like head and neck, extremities, the breast. Once we start getting deeper, like into the abdominal cavity, then it's less likely that we're going to see clear kind of patterns with it because it's too far from the skin. So we will see the digestive, disorders, as I showed you with those, vertical patterns on either side of the abdomen or the mottling patterns. If there's, for instance, like liver congestion, we'll see like a diffuse kind of air heat pattern that will be in the right upper quadrant. If there's, like acid reflux, going on, we'll see heat patterns that'll be kind of in the center area to the left side. The organs per se, again, we're looking at the physiology. So it's the deeper organs we're not going to see, like the uterus, the ovaries, the kidneys, they're not going to show up. But we're looking at the function. Yeah. So sometimes what people are interested in looking at, thermal imaging isn't the appropriate tool, for that. It may be that an ultrasound, is a better thing to do, as far as looking at the ovaries or the uterus or that kind of thing. So, yeah.
Excellent. Okay, I think that is it for the questions that we have. Yeah, that's all I can see right now.
Okay.
So I will just say thank you for this. Really fascinating. I can't wait to see where this goes. I think, I kind of envision this future where it's really standard practice to do this kind of image.
Yeah, I mean, and to me, it should be, where it's just like it's another great tool that we have, that you could have in all sorts of different doctors' offices, for that, the dentist, because like I said, a lot of times, what I'm seeing with thermal imaging for dental stuff, the dentist can't even see it, there. So that would be an invaluable tool, just to have. Yeah, I totally agree with you. Or to have it, your annual exam. It's like, what are they doing? Blood pressure and stuff like that. But I thought when I did physicals, when I was a doctor and doing clinical work, and it's like, this is ridiculous. I mean, what are we doing? You're just like taking their pulse to do the number of beats per minute and the blood pressure. Like, who cares? I mean, that's not telling you that much stuff, some, blood work. But yeah, that would be like an amazing thing if it was, like a tool that we had for all people's, annual examinations.
Yeah. Yeah. I think it's coming. Okay. One last question. Do you see the hips in the half body visualization?
No, so the hips are a separate, thing. We can do the hips, too, but there's it's kind of an additional imaging that we do to specifically look at the hips. Yeah.
Okay. All right. Well, thank you. Thank you for this. Really enlightening, and I'm very excited about it. So can't wait to see you when you come up in April. Safe travels, and thank you everyone for joining us this evening. And we'll see